Namaskar, Adab, Sat Sri Akal. Welcome to the special episode of the DN Talk Show. We welcome you all to the DN News, and this special episode is specially designed for people who are suffering with heart diseases or who are prone to heart diseases due to some or the other reason. We have here with us today an eminent, internationally renowned cardiac surgeon, Dr. D.K. Satsangi, who has been a director professor of G.B. Pant Institute of Postgraduate Medical Education and Research, New Delhi, and also had been the head of the Department of Cardiothoracic and Vascular Sciences, All India Institute of Medical Sciences at Rishikesh. We in the society are prone to have heart diseases every now and then. Reasons could be small, reasons could be big, but there are reasons that take you to heart diseases, and these heart diseases may even result into death. Heart attacks are serious, and we must have appropriate and adequate knowledge to manage such heart attacks in case there is no health facility around your house or around where you are having the stroke. We have here Dr. D.K. Satsangi, who will enlighten us on how to manage such heart strokes and how to treat the heart strokes after the heart attack. We will talk about coronary artery diseases, and I would request all of you to please listen to the talk to Dr. Satsangi, what he is speaking about on the heart diseases, and if need be and if you want, you can ask your questions to us. If you have any question, please note it down, and at the end of the talk show, please call 8800126010 and we will connect you to Dr. Satsangi and you can ask your questions right there. You can also WhatsApp your questions to us on the same number 8800126010 and we will share this question with Dr. Satsangi, who will in turn answer your questions. So not wasting time any further, we request Dr. Satsangi to please start the show, and Dr. Satsangi, welcome to the DN News in the DN Talk Show. A lot of people are watching you at the moment, and people are interested in knowing how to come out with these kinds of heart attacks if sudden heart attacks are there, because normally the heart attacks are sudden, but there are reasons and causes due to which people have heart attacks. So we would like to know many things. We have many questions in mind. People are worried about how to get rid of such problems. So can we first know from you what is actually a coronary artery disease? What is it?
Thank you very much, Devenji, for inviting me and sharing my experience with the audience. It's really a pleasure for me to share the knowledge about heart attack and to advise my fellow countrymen about this dreaded disease, which is often fatal. I welcome all of our audiences and a very good evening to them. Now, coming on your question, what is coronary artery disease? I would rather first like to tell what are the coronary arteries. Now, as you know, the heart muscle is the most miraculous muscle of the body, and it starts functioning before the birth of the child, and without taking its rest, it keeps on pumping blood for on an average patient of 70 years of life. So it beats billions of times and pumps millions of gallons of blood, circulating them into all the parts of body. For this work, the heart itself needs the nutrition or the food which is supplied to it from the very first branch of the aorta. These are a pair of coronary arteries which are known as left and right coronary artery. The coronary arteries brings blood, food and oxygen to the heart muscle. And with this supply of nutrition, the heart muscle keeps on working unceasingly throughout the life. Now, coming on, what is the coronary artery disease? Now, as you might have heard, in the blood, there are various lipids and cholesterol factors. These are the fatty materials. These fatty materials are circulating in the blood. In some patients, where there is a very high quantity of cholesterol material in the blood, this blocks these coronary arteries. And as you can imagine, with this blockade of coronary artery, the blood supply cannot reach to heart muscle. And with the result of that, that particular part of heart muscle, which is being supplied by that particular coronary artery, experiences the ischemic pain. There is severe pain starts in the heart and what we call as the angina pectoris. Angina pectoris is a severe chest pain which is of cardiac origin, that is arising from the heart due to the deficiency of blood supply to a part of the heart muscle, which we also call as myocardium. When the supply is partially occluded, we get these symptoms known as angina pectoris. But in cases where there is complete occlusion of the coronary arteries, no blood supply reaches to that part of the heart, and therefore, due to the lack of blood supply, that part of the heart muscle dies. When there is a death which is due to the ischemia or lack of blood supply, in the scientific terms, we call it as ischemic myocardial necrosis. And this is what we term, in layman's term, is the heart attack. Please switch on your mic. Your microphone is not on. Devinder.
If we talk in layman's language and we want to understand as a layman the symptoms of these coronary artery disease, what a person, how a common man would understand that this is a coronary artery disease and he is more now prone to have a heart attack. How does he detect and how does he have that knowledge?
So let me first tell you that what kind of patients are likely to suffer from the coronary artery disease. Usually these are the patients who are obese, who are elderly, 50 years onwards. These are the patients who may suffer from diabetes, who may suffer from hypertension. These are the patients who undergoes through a lot of stress and strain. Those patients who are smoking, those patients who are having a diet, their diet is very rich in cholesterols like lot of butter, ghee, milk products, meat, red meat. So all these things, this kind of patient, not much relaxation, always tense with his job. So these are the type of people, and when they experience the pain in the chest, now this chest pain usually come on exertion. When they are walking for a long time, they start suddenly feeling as if they are having severe chest pain. And along with the pain, they also have profuse sweating. Now, this pain may be confined to the chest in front of the heart, or this may also radiate. This may go to the opposite shoulder, this may go to the neck, or there may be pain in the jaws and teeth. Now, this pain is also affected by nervousness. Patient becomes very nervous, and his skin becomes cold and clammy. His pulse becomes very thready. That's a small volume pulse, and sometimes patient may go into the fainting attacks. Now, if somebody is having these kind of symptoms, it is most likely that they are suffering from angina, that is pain due to the heart ischemia. When these patients take rest or they take a tablet of the sorbitrate, their pain disappears and they improve. Again, when they try to walk, the pain comes back. This is a very common symptom of the coronary artery disease. Secondly, as I said, if suddenly the coronary arteries gets completely blocked because of a clot formation or because of a cholesterol block, and then there won't be any supply of blood to the heart muscle. In that condition, the heart muscle will die, and this is what we call as heart attack. Symptoms of heart attack are again a very severe, excruciating pain, the faintness, there is a difficulty in breathing, there is profuse sweating, there is cold, clammy hands and extremities, and such patients, will not be able to breathe properly and will be having severe pain. Now, this is a condition of heart attack, but should realize that this is a very serious condition, and if these patients are not helped or treated, they may succumb to their heart attack and they may lose life. So, in such conditions, as I will discuss later, that what we should do, how to help these patients, and after that, I will also discuss that how to prevent the coronary artery disease, how to prevent heart attack. So this is what are the symptoms of heart attack.
Okay, if I talk to you in a layman's language, what exactly is angina pain? Some people say if you have pain in the right hand, right from here to this place, a severe pain, and they say it's angina pain. Some people say if you have pain here, right in the middle of your chest, then it's an angina pain. Or some even say that if you have pain here in the shoulders, between the shoulder and your neck, in severe pain, then it's maybe an angina pain. What exactly? How do we understand what is angina pain and what is a muscular pain? How do we differentiate between both of them?
This is a very relevant question. I'm very glad because most of the patients would like to know, laymen, that when they get a pain in the chest, is it because of the muscular pain or is it the gastric pain because of the formation of gases in the stomach, or it is related to heart, that is, it is angina. Now, this is very important for a patient to know that a classical angina pain, a typical angina pain, will come on exertion. It doesn't come on rest. When a patient exercises, patient walks rapidly, he feels as if he is having pain in the chest. And this is an excruciating pain, stabbing in character, and this pain is radiating. It may not be localized in front of the chest, that may radiate to different parts of the body. So patient also feels the pain on the inner side of the left arm. So as you see, the inner side of the left arm, patient feels pain along with the pain in the chest. This pain may also radiate to both jaws. He feels as if he is suffocating, he is choking, there is a chest pain, and then he is having pain in both the jaws. Then this pain may be radiating to the teeth also. Some conditions, it may radiate to the back as if it is burrowing back. So these are the common radiation of the chest pain. The other feature of angina pectoris is that when you take rest, the oxygen demand of the heart muscle gets reduced. So whatever blood supply is available, that is sufficient enough to nurture the myocardium, and therefore the angina pain is relieved. The other feature is that if you take a tablet of sorbitrate and put it under your tongue, this gets dissolved and your pain is relieved. So these are the types of typical angina pectoris pain. There are different other types of anginas also. Like there are stable angina, there is unstable angina. Unstable angina or a rest angina. When coronary artery disease is so severe and the blood supply to the heart is so critically compromised that patient feels pain even at the rest. And this pain may not disappear. It may persist for a long time even after taking the sorbitrate tablets. This is a medical emergency, and such patients should immediately rush to a cardiac center and they should be managed in the intensive care units. Otherwise, these patients may suddenly die.
Okay. Now I have another question in mind. Actually, someone has called us and he wants to know. You said that in case of angina pain, you have to take a sorbitrate tablet, which you need to put it under your tongue. Now, supposing it's not an angina pain and the patient feels that it is an angina pain, or out of panic, he just takes a sorbitrate tablet under his tongue. Is it harmful to take without angina pain, or is it safe to take in any condition?
That's a very good question. I would say that patient may think if it is not an angina, it is not a heart pain, and if I take a sorbitrate tablet, it may have side effects, it may lower my blood pressure, or it may make my condition serious. But usually it does not happen. It does not happen. And most of the time, if it's an angina pain, after taking rest, it will be relieved. And even if you take one tablet, that is 5 milligram or 10 milligram of sorbitrate tablets, they are not going to be fatal. They are easily tolerated by the body. But it doesn't mean that you should be satisfied taking a tablet of sorbitrate or taking rest and thinking the pain is gone, there's nothing to worry. In fact, these are the alarming signs, and this shows that your coronary arteries are diseased and they are blocked. Therefore, one should immediately go to his cardiologist, and his cardiologist will perform a battery of investigations, as we commonly hear the electrocardiogram or ECG. Then we have an X-ray chest, then we have echocardiography, and also we commonly hear about the Holter testing. So all these tests he will perform, and maybe a treadmill test also, or he may even have to do coronary angiography. Nowadays there is non-invasive coronary angiography available and invasive also available. So after doing these investigation, the doctor will be able to tell the patient that this is the problem. Your problem is that you have blocked coronary arteries, and there are so many. Usually there are three major coronary arteries and their branches. So he can clearly tell that these coronary arteries are blocked, which are the cause of your problem, and this can produce severe heart attack. Therefore, you should go to some kind of intervention if required, or medication, as you said. The medications are usually, I will discuss it when we go for the treatment, but they are usually the coronary dilators, what we said, sorbitrate. We have got the agent which reduces the heart activity and therefore reduce the oxygen demand of the heart, just like beta blockers, so and the calcium channel blockers, etc. So that should be left to the patient's physician, cardiologist. Patient should not treat himself because these are very critical conditions.
Okay, there are two more important things that I need to know. One is that in such cases, when you have pain in the chest, when you have pain, some kind of angina pain you suspect, is it advisable that you go to a family doctor or you need to go to a cardiologist specially and get yourself checked up? What do
You
you
see,
suggest?
if you are having severe pain, there is a one dictum which shows this time is the muscle. If you lose more time, the more muscle will die. The patient is suffering from heart attack. Therefore, without losing time, you should go to an experienced cardiologist, and that too also a tertiary care center. A center which has got the facilities for all kind of investigations. It has a cardiac catheterization lab where an angiography can be done in emergency, and a balloon angioplasty should be performed to relieve the obstruction immediately without wasting any time. Sometimes, and patient should not wait that he has called for ambulance and then I should go to the hospital. Whatever conveyance is available, they should take it and reach hospital immediately, inform their doctor in advance that such patient is coming, so they are ready to receive these patients. They can do the urgent investigations and go ahead with the intervention to salvage his life.
Okay. So in nutshell, if I ask you, what are the ways that we can prevent heart attack and not have such kind of problem in the life? In nutshell, just two
Yes,
or
this is a
three
very
points.
good question. A very healthy lifestyle.
Yeah.
As I said, the most common cause of coronary diseases are number one is smoking, number two diabetes, number three is blood pressure, number four is a very fat-rich diet, number five is obesity or the overweight, number six is lack of exercise or healthy entertainment, number seven is lack of relaxation, a very tense life. In today's time, the more and more people are very ambitious. There is a cutthroat competition. They have no time for relaxation. There is no time for sleep. So all these things are responsible for coronary artery disease. But above all this, I would say again that those patients who are having heredity, some of them have family incidences of the heart attacks, and they are more prone to develop coronary artery disease. So one can summarize that they have to change their lifestyle. Number one, they should stop smoking. That's very important. Number two is if they are diabetic, then they should get their diabetes under control in the guidance of a good physician or diabetologist. If they are having hypertension or high blood pressure, their blood pressure should be kept within control with the help of medicine or with the proper exercises or whatever the physician suggests to control his blood pressure. Number four is diet. That his diet should not be very rich in fats. He should take a diet which is more rich in a fibers. The fibers are found usually in the vegetables. So he should take a lot of vegetables. He should take a lot of salads. He should take fruits. If he's not diabetic, he should take fruits. These are all the diets which gives him the fiber. The fibers reduces, his cholesterol level, and fibers also reduce his diabetes. So this is very important. And then he should avoid taking the rich food. Like he should not take, all the rich food and fried things. Like in our Indian systems, we are very fond of eating, puri, kachori, samosa, pasta. All these things are very harmful for the heart patients. And in addition, should not take too much of milk products, like drinking too much of milk, taking too much of butter or ghee. All these things are, and cheese also are very harmful for such patients who suffer from coronary artery disease. They should be trying to be vegetarians because non-vegetarian food, particularly the animal fat, and then the red meat and the eggs, so all these are harmful for the heart and they should avoid it. And perfect control of the weight. If they are obese and overweight, they are more likely to suffer from the coronary artery disease. To control their weight, they should consume less calories, they should eat less food, they should do proper exercises. This may be a long walking, they should walk, uh, and they should do even treadmill also. Treadmill is a good exercise, or even cycling, stationary cycling is a good exercise. But the best exercise is the sports. If they can play a set of badminton, or they can do swimming, or yoga. Yoga is very good. And if one does a yoga regularly, the yoga also not only relaxes the system, but it's a good exercise. And this also controls your blood pressure, this controls your diabetes, and this also reduces the chances of developing coronary artery disease. So these are the various things a heart patient should do. But above all, the most important is he should be under the constant care of his cardiologist. He should go to the cardiologist whenever he calls him, maybe once in 3 months, or once in 2 months, or 6 months, whatever is the need, and should get the regular investigations done to see whether the coronary artery disease is progressing or it is stationary. Most of the time, the disease is progressing. Whatever is the degree of block, it is progressing, and therefore it may lead to the fatal consequences. So I think that is how he can prevent this heart disease, and he can prevent a heart attack, and he can hope to live for a longer life.
Okay, so this means, as you said, that we should not waste time in taking the patient to an expert cardiologist in a tertiary care unit, hospital where cardiac patients are treated. In case of people who reside in remote villages and the hospitals are very far off and they have no mode of transport, neither ambulances are available most of the time, it becomes, you think, very difficult to save the patient. The local doctors can do something to save the patient. You have any advice for the local doctors?
Yes, I think very rightly you said, because this is a very common condition in our country. Most of the patient lives in remote places. There is no connectivity, there is no roads, there are no conveyance, there is no local doctor to advise these poor patients, and therefore they don't reach the hospital in time, and many precious lives are lost. I think on these lines we should have a collective effort in which not only the medicine community, the doctors, but the government and government hospitals, health workers should also be actively participating. And we should create an awareness among the people through television or through pamphlet or in the newspaper or by frequently visiting these villages and talking to these people that what is the coronary artery disease, what is the heart attack, what are the symptoms of heart attack. If they get such thing, then they should know where they have to go. And so as I said, that we have to enforce the primary health center. Earlier, there were a lot of primary health centers which are not functioning properly, but we should have a doctor who is well trained, and once such patient comes, he should make an arrangement for transporting these patients to the tertiary care center. But also, as you said, if it is a case of heart attack, an injection of morphine does help. If you give an injection of morphine, it takes care of patient's pain, number one. Then there are certain clot busters. These are the agents which are anti-coagulant agents, and those clots which are blotting the coronary arteries. When you inject these drugs, they are thrombolytic agents, the clot busters, and if you give them urokinase, streptokinase, these are the common things. they will immediately dissolve the clot and open the coronary arteries. And after that, once the patient's pain is relieved or he recovers from heart attack, he can be safely transported to a tertiary care center. So this is very important. A lot of work has to be done. You are very rightly said, because most of our patients, they are very vulnerable, and they don't have, proper medical care available to them, and they don't know in case of emergency where to go, and so this is also job of all of us, responsibilities of all of us, that we should think in these terms.
Dr. Satsangi, you are a very experienced cardiologist, cardiac surgeon, in fact, and you have been in the line for about more than 40 years now, I think. And you have also undertaken more than about 20 to 25,000 open heart surgeries. Why don't you use your expertise and experience? If need be, we can join together and form some kind of a platform here through our channel, so that we could provide on the spot advice to the doctors who are remotely settled in villages and who do not know what to do with such kind of patient. If we can get this awareness up to that place, up to that doctor in the remote areas, and if they can connect to us at that time, if you are willing, we can definitely form some kind of a platform here on this news channel and provide assistance at the emergency times to those people. If you just think on it, we would be pleased to have such kind of thing, an association with you in the future, if you think it is the right approach. And now coming back, due to shortage of time, we have almost covered the primary things of an heart attack, how to manage, how to treat, how to protect, and how to prevent these things, these kinds of attacks. But definitely we are going to talk in detail about other aspects also of the heart attack, like the bypass surgery, the angioplasty, and many other things relating heart in near future. I would expect you to join us again on Monday, 8 p.m. and then we will cover about bypass surgery and angioplasty, so that people know how to deal with it and people can decide on whether or not go in for an angioplasty, and what is the stage where they should go for angioplasty, how they will understand, because when doctors advise, they will just say okay. So whether it is the right kind of advice or not, how does the patient understand that? All these things we will cover in the next episode with Dr. Satsangi. It has been a great pleasure to be with you, Dr. Satsangi. We are really too much pleased to have you on this platform, and you have said so many things that really create awareness amongst the common men of this country. And I definitely hope that people of this country will be benefited by whatever you have talked today on heart diseases. So it's time to sign off now, and we shall be right back on Monday, 8 p.m. So do not forget to tune in at 8 p.m. on Monday next. Till then, keep watching the DN News. Thank you very much. Good night. Shubhratri. Shabba Khair.
Thank you very much, Devenji. Thank you very much.